I looked around and I immediately started thinking like, well, this is like the ultimate playground for a physical therapy clinic. Because it's so different than anything else I had ever seen at that point. I mean, a clinic with climbing walls, a clinic with equipment that's designed for Formula One race car drivers. I'm the founder, one of the two founders and CEO of PhysioFitness. We came to start this clinic about a year ago. The equipment and everything was here already, but we added physical therapy services to this. Traditional physical therapy tends to use more weight equipment and maybe cardiovascular equipment. But there's a critical other difference in the approach, and the difference there is that typically in physical therapy, people work with what's called an internal focus of attention, which means that physical therapists, and I was trained the same way, I must admit, physical therapists have a tendency to tell patients, put your foot here, put your left foot here, or if you have a back patient, tighten up your stomach, make sure you do this. And research has shown that that really does not work as well. In fact, it can actually interfere with learning new motor skills and doing your exercises properly. So what is very different in this clinic, that the equipment lends itself to giving people what's called an external focus of control. Can you knock out that light? Can you step on this? Can you push this object forward, or things like that? And there's a lot of research that shows that that works much better. Patients learn the skill much quicker, patients have much more fun doing it, and they're much more accurate. Hitting a golf ball works much better if you focus on the ball and not on your own posture. In fact, when you focus on your posture, straighten out your back, make sure you rotate, put your hand here, hold the club like this, you will never be a good golfer. What we can do here, we can go to equipment. I mentioned equipment for Formula One race car drivers. We can put you in front of that. It's a nice little frame, but just little lights all over the place, and we can program them randomly in whatever order we want. We can make it really hard, we can make it a little bit easier, we make it for people who can barely do anything. But in the meantime, we may put you on an unstable surface. We don't tell you, make sure you keep your ankle straight, because that would be an internal focus, but what we do instead, can you knock out these lights as fast as you can? What they're really doing, they're training their brain, they're training their body from the bottom up and from the top down to incorporate the ankle back in the body schedule. They get their stability, they will train their ankle without knowing they're even doing it. We see young children in here, we see retired individuals in here. But the more we do here, that we realize that there really is no patient population where you cannot apply this to.